Hello, my name is Dr. Alita Eck. I'm an internist in private practice in New Jersey. I'm one of a growing number of physicians who is very concerned about where our country is headed in the area of health care. This is May 1997, but in May of 1962, a drama was unfolding where a president was advocating increased involvement in the paying of health care bills, while a physician was voicing a word of caution. The president was John F. Kennedy, and the physician was Dr. Edward-Annis, a general surgeon from Miami. Dr. Annis later became president of the AMA and the World Medical Association. He has written the book entitled Code Blue, Healthcare in Crisis. Just like today, in 1962, there was a push for the socialization of medicine. It was clear that there were poor elderly people who could not afford health care or insurance. So as President Eisenhower was leaving office, he passed a bill called the Kerr-Mills Bill. This was a program that would provide for the needs of the poor elderly and required that people submit evidence of their inability to pay. There was a movement afoot to extend this medical care to all the elderly. The reasoning was that since medical care is a right, no one should have to prove he needed help paying for it. When President Kennedy came to power, Congress introduced what was called the King-Anderson Bill. This was the first major irreversible step toward the complete socialization of medical care. The King-Anderson Bill was never insurance, but a forcing of one segment of our population to underwrite the payment of health care for another, regardless of need. The Democratic Party decided to make the King-Anderson Bill the major legislation that they would push. 5,000 public speeches were planned across the country in the spring of 1962. An atmosphere of national crisis was contrived as press coverage, radio and television, and leaflets were distributed. The campaign would culminate with a nationally televised address by President John F. Kennedy in New York's Madison Square Garden on May 20th, 1962. The hall was to be packed with the Union's National Council on Senior Citizens and would be carried live on all 3 television networks, free of charge as a news event. Let's take a look back to Madison Square Garden in 1962. President John F. Kennedy is beginning to speak.
I come to New York because I believe the effort in which we're engaged is worth the time and effort of all of us. I come from Boston, Massachusetts, near Faneuil Hall, where for a whole period of years, meetings were held by interested citizens in order to lay the groundwork for American independence. And while there may be some who say that the business of government is so important that it should be confined to those who govern, in this free society of ours, the consent, and may I say the support of the citizens of this country is essential if this or any other piece of progressive legislation is going to be passed. Make no mistake about it. We say that during his working years, he will contribute to Social Security as he has in the case of his retirement, $12 or $13 a month. When he becomes ill, or she becomes ill over a long period of time, he first pays $90 so that people will not abuse it. But then let's say he has a bill of $1,500. This bill is not that we're talking about Mr. Anderson's bill and Mr. King solve everything, but let's say it's $1,500, of which $1,000 a hospital bill. This bill will pay that $1,000 in hospital bill. And then I believe that he and the effort he makes in his family can meet his other responsibilities. Now that does not seem such an extraordinary piece of legislation 25 years after Franklin Roosevelt passed the Social Security Act. There are doctors in New Jersey who say they will not treat any patient who receives it. Of course they will. They are engaged in an effort to stop the bill. It is as if I took out somebody's appendix. The point of the matter is that the AMA is doing very well in its efforts to stop this bill, and the doctors of New Jersey and every other state may be opposed to it. But I know that not a single doctor, if this bill is passed, is going to refuse to treat any patient. No one would become a doctor just as a business enterprise. It's a long, laborious discipline. We need more of them. We want their help, and gradually we're getting it. The problem, however, is more complicated because they do not comprehend what we're trying to do. We do not cover doctors' bills here. We do not affect the freedom of choice. You can go to any doctor you want. The doctor and you work out your arrangements with him. We talk about his hospital bill, and that's an entirely different matter. The point of the matter is that this meeting and the others indicate that the people of the United States recognize, one by one, thousand by thousand, million by million, that this is a problem whose solution is long overdue. And this year, I believe, or certainly as inevitably as the tide comes in next year, this bill is going to pass. This bill serves the public interest. It involves the government because it involves the public welfare. The Constitution of the United States did not make the President or the Congress powerless. It gave them definite responsibilities to advance the general welfare, and that is what we're attempting to do. I visited twice yesterday and once today, a hospital where doctors labor for a long time to visit my father. It isn't easy. It isn't easy. He can pay his bills, but otherwise I would be. And I'm not as well off as he is. I understand that there's going to be a program this week against this bill in which an English physician is going to come and talk about how bad their plans are. It may be, but he ought to talk about it in England. Because his plan and what they do in England is entirely different. In England, the entire cost of medicine for people of all ages, all of it, doctors, choice of doctors, hospitals, from the time you're born to the time you die, are included in a government program. But what we're talking about is entirely different. And then finally, I had a letter last week saying you're going to take care of all the millionaires and they don't need it. I do not know how many millionaires we are talking about, but they won't mind contributing $12 a month to Social Security. And they may be among those who will apply for it when they go to the hospital. But what I will say is that the national government, through the tax laws, already takes care of them, because over 65 they can deduct all their medical expenses. But I refuse to see us live on the accomplishments of another generation. I refuse to see this country and all of us shrink from these struggles, which are our responsibility in our time, because what we are now talking about in our children's day will seem to be the ordinary business of government.